liver is an important part of our bodies. It performs many vital functions. If one of those functions are filtering the body of harmful substances, destroying old blood cells that are old, have defects, or are no longer needed. That is done by first breaking the hemoglobin molecule, and the iron gets recycled. The liver also stores different types of vitamins, including vitamin A, D, E, B12, and vitamin K. The liver converts nutrients into forms that can be used by the body. For example, carbohydrates, which are available in our everyday foods, are converted to glucose, which is used immediately for energy. The liver also produces chemicals that are used in clogging blood. For example, if you get a cut, these chemicals will help stop the bleeding. Hepatitis or hepatitis B is the inflammation of the liver. It is caused by a virus, the hepatitis B virus. The hepatitis B virus uses humans as its reservoir, as the virus is transmitted to humans by humans. In Canada, hepatitis A, B, and C are the most common types of hepatitis. Around 600,000 people in Canada live with hepatitis B or C. The most common ways of transmission of hepatitis are through contaminated food or water. This is more common in developing countries where there's no access to proper sanitation. Hepatitis B is also transmitted through infected blood. This can happen through needles, organs, or any blood contact with an infected person. Another way of coming in contact of infected blood, which as you can see is less common. Sharing personal items such as toothbrush is also a way of contracting hepatitis B. The most common and most known way of contracting hepatitis B is, of course, having unprotected sex with an infected person. Hepatitis B can also be passed from mother to child during pregnancy. One of the symptoms of hepatitis B is jaundice, which is yellowing of eyes and skin, which happens due to excess pigment. Having dark urine is also another symptom of hepatitis B. Abdominal pain, which is due to inflammation of the liver. Joint pain is also another symptom. And lastly, loss of appetite. The biggest precaution you can take against hepatitis is taking the vaccine. The hepatitis B vaccine are widely available. The treatment depends if hepatitis is acute or chronic. In case of acute, patients will need a lot of rest, drink many fluids, and eat well. If the patient is a carrier, they will have a risk of having liver scarring, otherwise known as cirrhosis, caused by multiplying viruses in the liver. If a patient is diagnosed with chronic hepatitis B, they will be given antiviral medication to slow down the division of hepatitis B virus to slow down liver damage. If the scarring damages the liver severely and the liver can't function properly, causing a life-threatening problem, a liver transplant is the next step.